May is Osteoporosis Month, so what better than to have Dr. Alan Hibbard. He's an orthopedic surgeon with Baptist Health Systems and San Antonio Orthopedic Group here with us today. How are you, Dr. Hibbard?
Very nice, thank you.
Well, good to have you. So tell us, what is osteoporosis?
Well, osteoporosis is a disorder in which your bones start losing their density. Now, for a bit of background, your bones are alive, they're active. And as you live, your bones are breaking down, they're rebuilding themselves. And in childhood, of course, you're building more than you're losing. Most people max out their bone density around age 30, and then there's a steady decline. Usually you lose about 10% per decade, except for women. When women go through menopause, that rate speeds up very rapidly. And so that's why osteoporosis is more of a problem for women.
Okay. Now, in your experience, is that what you've seen? It mostly affects women, or who's most at risk for osteoporosis?
Well, Claudia, that's a very good question. As I mentioned, most of the time this is a problem with women, but there are a lot of things that you can do to change that. What's important for your bones is their bone metabolism, calcium, and in particular vitamin D. So usually what we do to work on is to make sure that the nutrients are there for your bones so they can remain healthy, and to eliminate or at least minimize the slow decline that you have over time.
Okay, so some advice for when it comes to nutrition. You mentioned vitamin D and other things that are important to prevent osteoporosis. What do we have here, and are these some of the products that could possibly help us be healthier?
Exactly. What you want to do is eat and consume things that are heavy in those kind of things, like calcium. You get in orange juice, in particular dairy products, whether it be like yogurt or cheese or milk. Green leafy vegetables are important, like spinach, bok choy, broccoli, those kind of things. Very important. But I must say, the most important thing, in addition, what your body does, to get that calcium to go into your bones, you have to exercise. Okay. If you just eat the food and sit on your couch, it's not going to help you. Exercise is the key.
Okay, so for busy women and busy people all around, what kind of exercises should we be doing on a daily basis, and how much time? Because sometimes it's kind of hard to fit it into our busy schedules.
Well, that's true. Now, one of the problems we have in our culture is what we call the sitting disease. Our ancestors sat only probably to eat and to lay down at night, to sleep, but most of the time they were very busy. The average American probably spends 3/5 of his day sitting. That's about 9 hours a day. So part of our jobs involve a lot of sitting, but we need to change that around. If you could incorporate some kind of physical activity, maybe go for a walk at lunch, take the stairs during the course of your day as a bit of a break. And then, of course, there'd be exercises for strengthening. You can just walk. You do yoga for stretching, weighted exercises for strength. Those kind of things are all very important.
Okay, so nutrition, exercise are two key elements to prevent osteoporosis. Of course, not all the time, but it could at least help you prevent it.
The more active you can be, the better. Probably for every hour you spend sitting, you probably should spend an hour or so exercising. So the exercise is the key. It's very, very important.
Okay, and some symptoms to watch out for?
Well, one of the problems with osteoporosis, and that's why we're so interested in getting the information out, is it's a silent disorder. You don't know that's happening until something catastrophic happens, like a fracture. Now, what we would concern ourselves is what we call fragility fractures. Your bone should be solid enough that if you fall from a standing height, you shouldn't break anything. Should you have a simple fall and a fracture and something breaks, we need to look at your skeleton. And so that's very important. So we just don't treat your fracture now. We send you to get studies and see if you could be one of those people whose bones are not as dense as they should be.
I see. So, doctor, in your experience also, what kind of ages do you see when you treat patients? Is it something that can affect anybody at all ages?
Usually starting at age 50. And one of the things we concern ourselves with, if you have one of these fractures, you have a very high risk of having another one. You probably have a 4 times risk of having another one and 50% chance of having another fracture within the next 3 years. If you let the process go on too far, what can happen is you can break your bones just by coughing or sitting down hard or even sneezing.
Okay, well, thank you for all your information today,
Sure.
Dr. Hibbard. All right, so now you know it. Nutrition and exercise will help prevent osteoporosis. Baptist Health Systems is celebrating Osteoporosis Month. For more, log on baptisthealthsystem.com or give them a call at 210-297-7005.